Look up medical malpractice and Sapan Dase, head of Surgisphere, creator of faked COVID-19 data. But we're not making money off this. We do not have a conflict of interest yet. Dieter Rault, the French guy who kept promoting hydroxychloroquine, attached his name to nearly every paper that came out of his institute or anything he could be associated with, sometimes offering lucrative adjunct professorships to people just to put his name on there and doing some little piddly work to increase his own institutional citation index as the most cited person in European Union. Once it was discovered this was done, or that he contributed nothing to these studies, and that there were 200 of them per year, or sometimes higher, but 200 on average, 220 something, people started realizing that he was faking his credential, as evidenced by his utter bombast about ignoring what he was talking about. Antimalarial hydroxychloroquine is a treatment for rheumatic diseases during pregnancy, among many other things. It's an early failed experimental treatment for COVID-19 thanks to people like Donald Trump and other people, including Dieter, demanding that it be taken seriously and taken without testing. The reason you have a double-blind study is that, if you're not aware of it, historically, medications have side effects. They still do, by the way. And in many cases, people would claim that the side effect of their snake oil, literally gasoline, or turpentine, or jet fuel, kerosene, mixed with alcohol, so you could avoid the laws against, selling booze in some areas to some people. They would promote their medicinal mixes and really talk up the effects, knowing that the placebo effect, aka you can make yourself feel better and just tough it out, can hide negative results and also explain away really bad outcomes. The side effects from some of these coinkadinkly medications we're going to talk about emulate having COVID-19 and always have. The medications we're talking about in some cases are very old and are known to cause flu-like symptoms. In fact, the listing is titled flu-like symptoms as side effects for, and then name that medication. But anyway, ignoring the diddler here, the Renault, hydroxychloroquine, failed experimental treatment for COVID-19 that has a history of side effects like vomiting, headache, muscle weakness, etc., acting like the flu. Also changes in vision, allergic reactions, and serious heart rhythm problems, significantly higher risk of death for people with COVID-19. No, that's part of the conspiracy. Meanwhile, a vaccine causing a total of 35 people to get sick in Europe out of 17 million doses, that's serious. But having an elevated death rate due to heart palpitations or just sudden death when you're treating a COVID-19 patient, you ignore that. And also, again, it emulates having the flu. So if you gave it to a healthy person as a preventative measure, you could say, oh, look, we caught you just in time. You just caught COVID-19. Imagine that. That is literally a technique that was used to sell things. See, also, I'm having a cleanse. I'm not sick. I don't have the raging runs. I'm not throwing up into my cookies here. No, that's purging the toxins. Because, yeah, if you remove toxins from a person's body, it's supposed to make them act like they've been poisoned. Ivermectin, routinely used to control parasites like worms in the gastrointestinal tract of ruminant animals. Animals. Also, for dogs, can be very dangerous of specific varieties. White feet don't treat, for instance. Therefore, it's not universally useful for what you might think it is. Has a history of side effects like headache, dizziness, muscle pain, nausea, diarrhea, joint pain, tender swollen lymph nodes, weakness, and fever. literally emulating COVID-19 in every way I could look up. And if you happen to have a mild case of COVID-19 or you're asymptomatic at the time, which is a high likelihood, it's like 30 to 40% of the people that you test, it would just make you a dead ass look like you had COVID-19, wouldn't it? Also includes itching, rash, eye swelling, redness, pain, and vision changes. What's with vision changes and these idiots selling you snake oil? Almost like Cotton Eye Joe. One of the reasons people would sell medicinals was so you could get around prohibitions in local ones, and also actually the prohibition against alcohol. It was legal to sell a medication, as long as you claimed to be a doctor or a pharmacist, that included alcohol in the preparation, because it was very common. But then again, ironically, during Prohibition, you could get cocaine. So let's continue here. Now really, seriously, fuck. But one of the side effects if you made, commonly occurring, moonshine, is the first layer of the alcohol you produce has to be discarded because it will contain chemically induced, dangerous, blindness-inducing alcohol on top. It's not that it's really strong, it's that it's the wrong kind. Chemically speaking, it'll cause damage to the eyes and also other problems. It can kill you. But why throw away such good smelling sweet stuff? See also people who subscribe to using turpentine as a treatment and then say, no, I'm not sick, I'm purging. Yeah, you're a sprinkler squirting crap everywhere. Would you please go away and die someplace else? Thank you. But anyway, both these medications have a habit of emulating COVID-19 symptoms at extreme doses. Let's talk about the findings that support ivermectin. They don't. Preliminary findings show it inhibited SARS-CoV-2 replication outside of animals, but only at toxic doses that would cause permanent damage or death to humans and definitively cause all of these side effects. Way above the maximum achievable dosage. At a tiny dosage that couldn't have an effect in a petri dish, much less in a human, in randomized clinical trials, or whatever you want to call it, found no difference in positivity levels for nasal swabs, nor in viral load between patients that received a placebo or got this medication. It did not reduce viruses. Because it's not an antiviral, it wouldn't be expected to do that. Whatever mechanism is proposed didn't happen. The effect didn't occur. Did it fucking work? No. Then why bring it up again? Well, in Bangladesh in a hospital, 72 patients, a tiny sample. A third of them were given a placebo. A third were given the medication in question, and a third were given the medication with one other medication that was shown to have positive effects. 5-day course. The duration of symptoms were no different. The outcome and death rate was no different. These were mild cases, in some cases going really bad. I wonder why some of them went downhill. 24 is a third of this. 24 got a placebo. 12 days of viral load. 24 got a 10-day viral load, but they are the ones that use the medication, 2 days shorter. 11 days shorter for viral effect for people who got the medication and another drug that was actually helpful, that was found already to work. So, if anything, it showed that it was contraindicated as combination. 2, if you get a small enough sample, a placebo will work as well or better than your medication. 3, when they scaled this up to a size that was larger, they found it had no benefit. And honestly, the funny part is the viral load durations got longer for people taking this medication. A double-blind study makes it to where true believers cannot fake being healthy, and true believers can't fake being sick when needed. It prevents the human placebo effect, which is, I will make myself feel better or tough it out. I'm going to repeat that. And again, I'm going to repeat. The medications in question simulate having COVID-19 under some conditions, and one of them definitively requires such a heavy dosage that it would probably kill you in order to get rid of the virus. But again, 37 people off in Europe somewhere having a bad reaction supposedly caused by the vaccine out of 17 million people getting the vaccine, that proves you should stop using it. But no, to hell with this group of people that literally shit their brains out from taking the medication and were worse off from diarrhea, dehydrating them, and in some cases causing heart problems and potentially killing them. Let's ignore that because Donald Trump has to be right. And a French medical person who's guilty of faking his, fluffing his own, he's a self-fluffer, fluffing his own resume. We should ignore that, right? And we should ignore the guy who is in malpractice cases and had to shut down his entire online operation because of faking COVID-19 data. Then we got Renault, again, promoting hydroxychloroquine to the exclusion of all medical testing and saying, oh, I don't give a shit if they had heart palpitations. They were going to die anyway. Death panel boy. Let's talk about the guy proposing that we use these. AltMed Piri Corey. Previously talked up steroids, which actually kind of have a useful effect, by the way. They're prescribed sometimes, obviously. Started the Frontline COVID-19 Critical Care Alliance, FLCCC. P. China joke. A group claiming to be a highly published, world-renowned critical care physicians and scholars group with 2 other doctors who went viral in a YouTube video and got used Ron Johnson in a Senate hearing to promote COVID-19 vermectin. I can't pronounce the word. I'm going to keep trying. It's not an antiviral, but they said it had special combination of antiviral properties, which it doesn't have. Overtly saying something that's contraindicated by reality, which, of course, is extremely attractive to people who want mavericks. I'm going to just say I can pick myself up by my bootstraps, which would make me hover above the ground. That doesn't mean anything, but that is literally something people like repeating. That's what picking yourself up by your bootstraps mean. It's a joke about doing the impossible. You did know that before you showed up, right? It's not a euphemism for stick-to-itiveness and stubbornness winning out. It's about being a fool. They avoided real testing of their claims by screaming, "People are dying!" but at the same time appealing to COVID-19 deniers that said nobody died from COVID-19. Strong unsupported claims based on studies with insufficient statistical significance, 72 patients, saying if used preventatively or treating early or late stage illness when you're less harmed, it's a miraculous wonder drug. Shilling it to COVID-denying anti-vax conspiracy theorists specifically. Literally marketing it to people who believed COVID-19 doesn't kill anybody when it has a 2% death rate, which is ridiculously bad. And then at the same time saying, well, people are dying so we can sell this. Of course, we're not selling it yet, and we're not involved in anything yet. Just like all of these people that I mentioned getting either kicked out of the medical profession or running off to collect their shill money in quiet isolation. On the net, you can find people saying thousands of people have been treated in combination with other medications and had no negative neurological complications, which is the major one that's discussed most of the time. The actual side effect list, again, I'm going to repeat this to drive it down your damn throat. It emulates COVID-19. Along with hydroxychloroquine, it is the perfect shilling drug. If you have a negative reaction, you blame it on the disease. If they don't die from it, you say you cured them. If they have no negative reactions, you say it prevented it. There is no such thing as a negative outcome if you stage this correctly. And just like selling beer or selling alcohol to avoid the prohibition, this flies under the radar if you package it correctly. Just like selling the purge, aka the cleansing products, you can get away with it. That doesn't make it effective. And again, hydroxychloroquine increase your likelihood of dying from heart attack, and this stuff just emulates the damn disease. Neither of them work. Thanks for watching. Have a good day. Good luck with that. Don't trust these liars, please.